Okay, let's talk about our patient today.
Our patient today is a dentist.
Young lady, a preeminent lecturer,
A dental hygienist.
from Bulgaria,
Buffalo, New York.
Atlanta, Oklahoma, Vancouver, Canada, Boston, Kansas City, San Francisco, Montreal, Munich, Germany, London, and Santa Maria, California. And we're going to place 14 Lumineers,
8 Lumineers.
10 Lumineers,
6 Lumineers.
10, 2, 8, 8, 10, 10, 8, 10, 8 Lumineers today on our patient.
And now we're not treating teeth anymore. We're treating smiles.
Isn't that beautiful? So let's look at the transformation from where we started and where we are. Our patient today is an example of that. I'd like to welcome you to a webcast showing the live placement of Lumineers on teeth. What makes Lumineers unique is that they're made out of serenade porcelain. They can be contact lens thin, but they can be any thickness you want to straighten out this smile that you just saw on the screen. With Lumineers, we only take away that which is not sensitive. Now, we don't give patients anesthetic because we want to use that sensory system to tell us if we're on sensitive tissue. I've been doing this for the last 25 years, 24 years. I've never given a single drop of local anesthetic. So how can we do this? Well, because we satisfy the objective. The objective is to get a stress-resistant, non-micro-leaking restoration aesthetic. And we're doing it for aesthetic reasons. And we're not taking away anything significant, so it's reversible. It's fantastic. It's too good to be true. So you can bond to porcelain, you can bond to enamel. You've got the rule of 55, 5 surfaces: enamel, porcelain, dentin, metal, old composite. It's the rule of 55. You've got to remember that. And the other is 5 steps: surface preparation, bonding to that surface, finishing, checking the occlusion, then look at the patient's overall appearance. The only difference in porcelain and bonding to enamel is in surface preparation. And when you're bonding a porcelain veneer over a porcelain crown, I don't put a lot of force on trying to open the contacts on the placement visit. Matter of fact, most of the time I try not to put a lot of force. But I'm very gentle with these silanated bonds when they're porcelain on both sides. So I have the patient back in a couple of days or a week. It takes about 24 hours for the silanated bond to really mature. So with that, Lisa's got everything set up here. If you look at this tray setup, it looks complicated. But if you were to put it into groupings, there's only be 4, 5, 6 circles of things, placing instruments. Here's the Lumineers that Lisa's prepared. Everything that I'm using is in that placement kit that you can see behind me. Finishing kit's in there. Everything's in there. You have that. You have a sapphire light. And you know how to do the procedures, and you're all set to go. Lisa's put porcelain conditioner on the porcelain veneers, and she's put the Serenade Prime on top of that. You need an organic acid to activate your silane. If you don't have citric acid, you have to get some. It has to be an organic acid to activate the silane. She's also polished his teeth with porcelain polishing paste because it has an enzyme in there, papain, to get rid of the plaque. So when we etch the teeth and we do surface preparation, we don't have any grease, because that's really what plaque is. It's grease. So you get rid of the grease and you get a better bond. You should not work with less than 4 power magnification. 4 power, okay? Physically, I'm going to be this far from the patient, but visually, this close. We talked about the sapphire light. The sapphire light is really good because it has the power to go through your porcelain. Now, what happens when the luminaire fits the model and doesn't fit the tooth? Probably took the impression out too soon. Got a little distortion. How do you recognize distortion in the impression? You don't. Best protection, leave it in the patient's mouth an extra 30 to 60 seconds. So when you think it's all set, then go on. All right, so the first thing we're going to do is we're going to put some paint on dental dam on the lingual side of these teeth. And I got some on the incisal edge, so I'm going to pull that off. But when they have diastemas in there, you have to be careful that you don't have it come from the lingual to the labial. The best way to protect your eyes is to close them. I place the light about ½ inch from the surface of the paint-on dental dam. That's the same material you use when you're doing chairside bleaching. He's got a porcelain bridge in here and won't be bonding to it. Close your eyes. And explore. And I got a little bit on this incisal edge, so we better take that off. But you just want to be sure that it's on the lingual side and it doesn't go through to the labial. Close your eyes. And wherever we have the paint-on dental dam, we won't get any of the Ultrabond or the Tenure to stick to it. And taking a few minutes to do this pays big dividends when it comes time to finishing and removing it. So I'm going to put some Etch N Seal on each tooth. And we have already checked these teeth for fit, at least Doctor has. And the reason I'm using Etch N Seal, it's 30% or thereabouts phosphoric acid and has aluminum oxalate in it. And then we're going to put a dentin bonding agent on there called Tenure AB. It's not light dependent, and it bonds to all composites. And one of the problems that a lot of dentists have when their veneers pop off is because they didn't get a good conversion. So we just put a lot of this on here. Now I'm doing the try-in with Ultrabond try-in paste. And we're going to try on a couple of these LUMINEERS now. Left central. Lisa always calls out the name of the tooth. Now, Ultrabond try-in paste is exactly the same composition as Ultrabond, except for one thing. It doesn't have any activator in it. Let's take a look at this. Now, these are the same shade LUMINEER. What shade are they supposed to be? B1, okay? And the tooth on the left, is left central, doesn't have any try-in paste. Tooth on the right has Ultrabond try-in paste. The only difference between the Ultrabond try-in paste and Ultrabond is a try-in paste does not have any activators in it. And that will give you the true color that you're going to get. Now, the reason you don't want to try LUMINEERS in, or any porcelain veneer, with the etched surface being a factor, is light goes forward until you exceed what they call the critical angle. If you go from one medium that's too different than another medium, that exceeds the critical angle and the light doesn't go forward, it bounces back. There's air between this porcelain veneer with no try-in paste and the etched surface. So you get bounce back from the etched surface. That's why you get a different shade than the shade you think you're going to get or that you want. And if you want to modify the shades, make them polychromatic, you can do all that before you start doing the etching. Did you already pick out your shade? Is this the shade you want? Let's try the other shade, the extra white one. So you can just see the difference in the shade between that tooth now and the one on the right. They're both the same shade LUMINEER. One has supreme white try-in paste, and the other one is just a little bit darker. You want this one? You got it. Now we're going to take Tenure S. Tenure S is a HEMA, and Lisa uses that to remove the try-in paste from the LUMINEER. The Tenure S will cause polymerization of the Ultrabond try-in paste. Left central, okay. Lisa always tells me, and then I always call it back out. You're probably wondering what this device is that I'm using. It's called a LumiGrip. And when I place these, I want to see that there's resin oozing out all over. And so you better ask the patient what shade they want, because if you don't give it to them, no matter how good it is, they won't be happy. There we go. There's the flexibility you have. Okay. Now the first bicuspid. And what I'm doing right now is removing some of the excess here. And we got Tenure S on that surface. You never want to do the shade try-in with Tenure S, because Tenure S is a HEMA resin system that removes it and cleans it up. And if Lisa doesn't get it all out of the luminaire, then the HEMA will cause the unset resin to set. Okay, now we'll take the 2mm tip and I'll spot cure each tooth for 1 second. Close your eyes. The purpose of the spot cure is to keep the luminaire from floating around. Close your eyes. Close your eyes. And when you place gently place the light on the luminaire, you don't want to put a lot of force on it, but you want to see enough so that you can see the Ultrabond oozing out around the margins. So we'll just take this off. I'm taking the 9mm tip and I'm using it for 5 seconds on each tooth. Now we have, what, 7 teeth here? So we're going to bond 7 teeth in less than 60 seconds. And you want to have clean, dry surfaces. You want to have them treated. And the Tenure S, we put on did 2 things. It removed the try-in paste. What it didn't remove, it would cause to set. You never want to do try-in paste with Tenure S on the teeth. So now I'm going to take the paint on dental dam off. And I'm using a Schure 349 instrument. Well, you'll see me using that a lot when we're taking the Ultrabond off. Wash it off. Okay, now we'll give everybody a peek on the lingual side with the hot plate. Now what I'm using here is a football-shaped diamond on the lingual side, and I'm just going around and blending. And all of these diamonds and everything are in the Clinician's Finishing Kit. Clinician's Finishing Kit is in the, I don't know what they call it, the 3-drawer kit with everything in it. So whatever I'm using, it's in that box. And anything I'm doing, you can do. Give me the Schure 349, because we're going to be taking the Ultrabond off, and I'm scraping it off. And this instrument, Schure 349, is an orthodontic band seating instrument. And it will never, ever scratch porcelain. Don't ever use your hygienist scaling instruments on glazed porcelain, because it scratches it. Now, it's not a problem scratching the porcelain if it's CeriSander, because you can repolish it just like enamel. It repolishes the same. I'm using a 12 Fluted Bur to remove the excess Ultrabond, and I'm limiting it to the interproximal embrasures. I don't like to take it across the labial surface. Now, why would I want to have more opacity? Sometimes I would, but I can get it with our bonding systems, and there I have flexibility. But if I order 70% opacity, I give up a lot of flexibility. So I want to be sure that I'm doing like 8 teeth so they'll match. So I rarely use the 70%, and I rarely use the clear, because very seldom are you putting porcelain veneers on teeth where you like the shade and everything. So now I'm coming back here with a long, narrow diamond. And remember, if I didn't have a shoulder in the tooth, now I have a little ledge on the porcelain, don't I? And this is where the CeriSander porcelain really makes a difference. I come back in, open wide, and I'm blending this porcelain to the tooth just like enamel blends to dentin. It never has a sharp shoulder, does it? And we got a little bit of Ultrabond. Now, one of the things that I normally try to do when, say, I'm just doing a normal patient, I try to get them out of the chair in about an hour to an hour and a half. Then they're not fatigued. You've had a dramatic change. But I always tell them that we're not finished yet. and I'm contouring the porcelain and the periphery, and I'm also getting a shoulder placed in here. So it'll have the emergence profile that you want. And I'm opening these embrasures so that when I get the CeriSaw in there, it'll cut through nice and easy. If you find that you have difficulty opening contacts, it's because you haven't taken enough of the Ultrabond out. Now, if you look carefully at the gingival labial surface of the right central, I've contoured that with a diamond. Now, I'm going to restore that luster to the same luster we have on the left central, because I'll use a 30 Fluted Bur to go over that, and then we'll use a Dye-Lite polishing cup with a porcelain polishing paste, and you'll get back that same luster. When I'm bonding porcelain to porcelain, I like to wait 24 hours. When I'm doing this, I just go through and open all the easy contacts that are easy to open. So generally, I open 3 out of 4 contacts on the placement visit on enamel. But if I can't get them open and I can't get all the Ultrabond out, that's good. Now I'm using a lot of controlled force and finger rest. But I want to show you that because everybody is amazed that you can get through the contact that easy. So let's go to these lowers now. I used to say do the uppers and then do the lowers, but I find that if you want to get an exact match, you're better off doing uppers and lowers on the same visit, if you can equilibrate. And there's the etch. It's clean and dry. For how long? Just long enough to get it covered up with resin. Tenure AB. There we go. Let me see if I can get this here. There we go. Left central. Right central. Right lateral. Let me see if I can get this here. There we go. I'm just going to go to the 9mm and the 5 seconds right away, and I'll probably do 2 teeth at a time here. Close your eyes. What I'm going to do right now is do the occlusion. Close. Look at these lower anteriors. Don't they look nice? It's all done for you. And I didn't have to grind away tons of tooth structure to do it. Okay, well, he's pretty good on the maxillary. We got to get that. Can you all see that? He looks pretty good there. And then we'll take a look at the lowers. Okay. And he's marking pretty good there. So you want to take off these inclines. And I'm going to take and shave off a little on the labials. And then I'll take the long, narrow diamond. I'm going to open these embrasures. Now we just get rid of all that excess Ultramont, open wide. And then I just go up these embrasures, and I go around these margins, and I take off the Ultrabond and the porcelain, and I blend it all together. And since the patient is not anesthetized, I would know if I was removing something on a sensitive area that I shouldn't be. And we'll go through the same process for opening the contacts on the lowers like we did on the maxillary. Now we get some more marking paper. gauze. Look how nice those look. I always enjoy that when I have the marking paper in there because it shows you the definition of the teeth with that nice background. And let's see what we've got here now. Well, you're biting on that bicuspid okay. Here over here. I'm going to take a little bit more in here. You're actually biting pretty well. Close. Close. So you should have cuspid guided disclusion. You should have anterior disclusion. It should be harmonious. If you can't do that, then you're going to have a lot of fractures. Okay, so we did occlusion. We've done everything, and I've opened a couple of contacts. I'm going to open a couple more. If I didn't get all the Ultrabond out, it wouldn't go through. If I got too much Ultrabond in there, then I just wait. See, now I'm using a little force here, so I start rocking. See me rocking here? And so that's all I'm going to do today on him, because I'll have him back for finishing. Now, see, I'm using a CeriSander now. It looks like a CeriSaw, but it's a diamond-coated surface, and I just open it up. But I never open these contacts up too much. But now when he's back tomorrow or a week from now, all these rough edges and the excess on the back of the teeth and all that will disappear. Now let's take a look at this next thing. Okay, this is the hugger bridge, see? And we've done no preparation to his teeth. He's got enamel on the bicuspid. Now he's got natural tooth structure on the bicuspid, and he's got natural tooth structure on the molar. And the only challenge I'm going to have is this hard area to get into and keep it dry and do all those things. But we're going to go for it. Now I'm going to see what it looks like in his mouth. Let's see if we can get that occlusal in there. And then that space will be filled in with the hugger bridge cement. Open wide. Now, this is going to be very challenging for me because I'm going to get this dry and etched, and we're going to keep the vacuum going. And Lisa's treated the resin with composite conditioner. We put 5 lowers on today and 7 maxillary on. Tenure AB. Tenure AB, Bowen's resin. Okay, and let's get some Tenure S up here now and move really fast. Okay, now let's have the light. And this is dual cured. Close your eyes. Best way to protect your eyes is close them. Okay, let's see what we got here. Okay, so we'll take this off here. And I'll start taking a lot of this excess off. And I'm not going to have him bite on this right away, because if it's premature, he's liable to push it down more and then break the joint. So I'm going to let him sit here. No, I cured the occlusal surface as much as I could. Yeah, the part that I didn't get the light to hasn't polymerized yet. Sure, wide. Now let's get the mirror so I can show what that looks like. I think we can take a chance now and see what the occlusion might be like. So don't bite as hard as you can. Just close and grind around. Well, there's that spot on that distal of that molar way in the back. I don't know if you can see that. Can you see it right on the distal marginal ridge of that second molar? So I'm going to grind away there. This is an important one because if you don't take this out, it'll give him an anterior shift. Open wide now. Well, what I'm going to do here is let the audience see what we've accomplished on your back teeth and grind around all over, left and right, forward and back. Open. Let's take a look in here and see what we've done. And we haven't opened all of this and finished it all, but maybe you can see how we put that hugger bridge in. Because we put that in, he's got an anterior slide now that we put in on that with this hugger bridge. So we've got to take that anterior slide out or it'll affect his occlusion. Just take a look at how this person's changed. Close. Now, that's full mouth reconstruction if I've ever seen it. And all it takes is somebody with a knowledge of occlusion, patience, and time. But let's show everybody what you've got now compared to what you look like when you came in. That's how he started 2 hours ago, 2 hours and 15 minutes ago. We have put in 12 units, 7 on the maxillary, 5 on the mandibular, and we put in a hugger bridge. So if you ever get a chance to come out this way, why, we'd be glad to visit with you, and don't hesitate to call if you got problems. We're here to help. And okay.
I wanted whiter teeth and straighter. The options were braces, ortho, which I didn't want because my teeth are small and I thought it will not look good if you close all the spaces I have. And I didn't want to put regular veneers because I thought veneers or crowns, that other two alternatives, it will be more drastic to cut my teeth and do them. I wasn't uncomfortable at all, and this is the truth. It was quick and easy for me. It wasn't quick and easy for the doctor doing it, maybe, but I was sitting nicely and comfortable, and it was very nice.